International Women's Day. International Women's Day, which was held on the 8th of March, as you all know. And the theme for International Women's Day this year was Break the Bias. And with respect to health, the International Women's Day theme was to assist women to be in a better position to make informed decisions about their health. So today we thought it would be interesting for an important health issue that maybe is often unspoken, and that is womb wellness. And so we're delighted to have Dr. Manchester as a guest speaker. So before I introduce Dr. Manchester, I just quickly wanted to just give you a bit of information about the format for the event. So what we'll do today is Dr. Manchester will give a presentation, and then after the presentation, we'll have a Q&A so that you can ask her any questions that you might have based on her presentation or based on any questions that you might have generally about womb wellness. If you have any questions or comments, you can put them in the chat box, and then we'll get to the questions during the Q&A session. So as questions arise, if you just want to chat or make comments, just feel free to do that. You're very welcome to do that. It's a safe space. And so without further ado, we'll just get right into it. So it's my pleasure to introduce Dr. Manchester. So I'll just tell you a little bit about Dr. Manchester. Dr. Manchester hails from Bird Rock. She earned her Bachelor of Medical Science degree in microbiology and immunology at the University of Western Ontario in Canada. And then she completed medical school at the University of the West Indies in Jamaica. Dr. Manchester then went on to complete her residency in obstetrics and gynecology, practicing at both the Cornwall Regional Hospital in Montego Bay and the University Hospital of the West Indies in Jamaica. Dr. Manchester graduated from her residency program in 2017, and soon after she returned to St. Kitts to begin serving her home country. She's also a fellow of the American College of Obstetricians and Gynecologists and has a particular interest in maternal fetal medicine. And outside of her career as an OBGYN, Dr. Manchester is a full-time mother. So over to you, Dr. Manchester, welcome, and thank you so much for being here.
Good day. Thank you for that introduction, Abby. Good day to everyone listening, and welcome. And it's my pleasure to speak to you guys today. Trying to condense a topic like womb wellness into a relatively short presentation was quite the task, because it encompasses so many different factors. But we're gonna jump right into it because, in the interest of time, because as I said, it's quite a big topic. But let's get into womb wellness and what women need to know about it. So first of all, what is the womb? Well, the womb is the same thing as a uterus, and it is a pear-shaped organ where a baby is carried during pregnancy. This organ is low in the pelvis, which is between your hips, and it is supported by your pelvic floor muscles. So there is a diagram showing you where your uterus lies in your body. And the womb is made up of 3 layers: an outer protective layer, and that's called a serosa, a middle muscular layer called the myometrium, and an inner layer called the lining of the womb, or the endometrium. So the uterus is the main female hormone responsive secondary sex organ of the reproductive system in humans and most other mammals. What do we need a womb for? What is the function of the womb? Well, the function of the womb is to nourish and house a fertilized egg until the fetus or the offspring is ready to be delivered. That is the only function of the womb. It is the only physiological reason a woman needs to have a womb, and that's the purpose. So womb wellness just has to do with having a happy, healthy uterus that will enable it to properly and efficiently carry out its function, and that will also prevent many disorders of the womb that can be caused by several factors throughout a woman's life. So to discuss this topic, I thought it would be easier and more user-friendly to categorize womb wellness in terms of age groups, in terms of the stages throughout a woman's or a girl's life where womb wellness is important and can be, all the different disorders can be discussed in a more systematic way. So first, we're going to be talking about child and adolescent womb wellness. Now, your womb wellness essentially begins in utero. And so we're going to start from birth. At birth, each baby is usually assessed by a pediatrician, that's the baby doctor, and they will assess the female infant to see if there are any abnormalities, obvious external abnormalities that can clue them in to something that might be wrong with the female genital tract or the womb. And there are some abnormalities that can be obvious at birth, and these are congenital. One of these abnormalities can be congenital abnormalities. Now, congenital just means you're born with it. So abnormalities of the female genital tract that a baby is born with. I'm going to get into a little bit more detail, not too much, but a little bit more detail on those later. Those abnormalities are called Müllerian anomalies, and I'll give you a little bit more on that in a minute. The other thing that might be obvious at birth is what's called false menses. And this is when a newborn female infant appears to be having a period or vaginal bleeding. And it's actually a normal event, meaning that throughout pregnancy, there's lots of circulating hormones in the mother's bloodstream, which also gets to the baby's bloodstream. So when a female infant is born and that cord is cut, there's a sudden withdrawal of estrogen from the mother once the cord is cut, and that can induce a withdrawal bleed in the newborn. And it appears as false menses. This is normal, as I said, and it usually resolves on its own. The other thing that may be obvious at birth is disorders of sexual development, where the genitalia of the infant appears ambiguous or abnormal. So almost like you see in this picture where you can't tell, are these male genitals or these female genitals? This may signify a normality further up in the genital tract, in the womb, etc. And so it's important for these things to be seen at birth so that early intervention can be instituted. Congenital malformations of the womb, this is what we were speaking about earlier, and these are Müllerian duct abnormalities. Müllerian ducts are basically the building blocks of the womb and tubes, etc. That is where all those organs originate from, that structure in the embryo when the baby is developing in utero. And if there are any abnormalities along that maturation process or development process with the Müllerian ducts turn into the genital organs, you can have any one of these abnormalities, which are listed here. They're classified in this system. You can have complete agenesis or hyperplasia of the female Müllerian organs. You can have a unicornuate uterus, which is where you essentially only have one half of the uterus developing. You can have didelphys uterus, which is a double uterus. You can have complete or partial bicornuate uterus, which is a condition where the uterus is almost heart-shaped. And you can have a complete or partial septate uterus where there is a piece of tissue almost dividing the inner cavity of the womb in half. And arcuate uterus is where there's almost an indentation in the womb. And then you have diethyl still bistral related abnormalities. Now, this is important because whereas most congenital abnormalities there isn't really anything the mother did per se that could have led to these abnormalities of the female infant. Diethyl still bistral is a little bit different because this was a medication that was used in the past in pregnant women to help them prevent miscarriage and support pregnancies, but it was found that it actually led to abnormalities of the uterus for female infants when it was used in their moms in pregnancy. So this is going to become important in terms of what we can do to help ensure that our babies in utero have the best outcome in terms of womb wellness going forward. So this is just a picture of some of the abnormalities I just spoke about. The top one is the uterus didelphys, where you see the double uterus. That's this picture as well. And then you also see here, this is a cornuate uterus. And then this is a complete septate uterus. This is a partial septate uterus, and this is a unicornuate uterus, okay? And then you have abnormalities at birth that are unclassified in the system that I was just speaking about. These aren't necessarily womb anomalies, but they can cause womb issues if they go unnoticed. So there is a condition called transvaginal septum, where there is a wall of tissue running horizontally across the vagina. You can also have vaginal agenesis, where the vagina doesn't develop and the womb may only develop partially or not at all. And you can also have imperfect hymen. So the hymen is a ring of tissue that surrounds the introitus prior to the onset of coitarchy or sexual intercourse. And in imperfect hymen, it's a complete wall of tissue that covers the whole opening of the vagina. And if that is left untreated, can lead to womb problems once puberty hits. Another condition that can affect womb wellness in the child and adolescent is precocious puberty. And this is the appearance of physical and hormonal signs of pubertal development at an earlier age than is considered normal. And this usually refers to puberty signs before the age of 8 years old. However, recent studies have come to indicate that signs of early puberty, breast development, pubic hair are often present in girls, especially Black girls between ages 6 and 8. So there is a little bit of a gray area in terms of what's considered younger than normal for puberty, but certainly before the age of 6 would definitely be precocious. And whilst there are significant consequences of precocious puberty, for example, an early growth spurt can affect the maturation of the child and the overall stature of the child in the future. So these things are important to address early on. So what can you do in terms of trying to prevent these problems, possible womb problems that your child can be born with or develop at a very early stage? One, be conscious and present. That's probably the most important part, right? Because early detection of these abnormalities is paramount to ensuring a good outcome. And, as mothers, we're the ones who usually are the ones bathing our children. We dress them, we wash their clothes, their underwear and all these things. We change their diapers, all of that. So it's important when we're doing all of that, that we assess for any abnormalities or anything that may be off. Do my daughter's genitals look normal? Is there any blood or discharge in her pamper or her panty, anything like that? Important to be conscious of that and present. When our children spend a lot of time away from us, especially with older, grandma, grandpa, etc., they may not be as conscious and attentive and even aware of the things to look out for. So being conscious and present with our female children is very important. Early presentation for antenatal care. This is very important for us pregnant mothers, and even preconception care, meaning you see a doctor and get a health assessment before, when you're in the planning stages of planning to get pregnant, because medications, as I alluded to with the diethylstilbestrol, some medications can affect your baby's womb health, and so you may have to discontinue or change those medications before you even try to conceive. Other environmental factors such as smoking, etc., can be avoided through your pregnancy. And if you need help quitting smoking, that can be accessed through your healthcare provider. And you can be educated appropriately on, health and diet throughout your pregnancy, the necessary supplements that you need to make sure your baby develops normally can be prescribed. And monitoring throughout your pregnancy can be instituted, because some of these anomalies can be diagnosed through testing and imaging, ultrasound, etc., throughout a pregnancy. And so if they're found early, it can help you to prepare and plan for if your baby may be born with any of these issues. Regular child wellness checks. So we have an advantage here in St. Kitts where, we have our regular well child and well baby clinics free of charge here in our public health system on island. So our children are followed up quite regularly. Mothers have the opportunities to voice their concerns at regular intervals throughout a child's life, free of cost, as I said. And this can help that you ensure your little girl is developing appropriately and her overall health, including her womb health, can be monitored. Vigilance in reporting any abnormalities, anything that seems off with your little girl, you make sure that you voice your concerns to your healthcare provider as soon as possible, because early intervention is key, and routing to subspecialized doctors, because a lot of these abnormalities actually need subspecialist doctors, not just general specialists. So you may need pediatric endocrinologists, gynecologists who specialize in adolescent and pediatric care, that kind of thing, which may not necessarily be available on island, but can be arranged otherwise. So vigilance and reporting is very important. Puberty. Now, puberty is the process of physical changes through which a child's body matures into an adult body.
Manchester, I think we've lost you. Okay, I think we've lost Dr. Manchester for a second there. So give us 2 seconds and we'll see if we can get her back.
Yes, so puberty. Puberty is a process of physical changes through which a child's body matures into an adult body capable of sexual reproduction. And it usually happens in a specific sequence. First, you usually have thallarchy, which is the appearance of breast tissue. And then you have adrenarchy and pubarchy, which is where your adrenal glands get activated and hormonal stimulation starts to produce body odor, increasing in sweat and skin oil, acne, etc., facial hair. And pubarchy is the appearance of pubic hair. And then menarche, which is the first menstrual bleed, is usually the last step. Right, so the first menstrual bleed is what is called menarche, and it usually happens once females have almost completed breast development and pubic hair development. And in the first years of menarche, after menarche, anovulatory cycles, or cycles where the young girl is not releasing an egg or ovulating, are more common. That happens about half of the time in half of the cycles. And so the cycles may be longer, or what we consider cycles to be a little bit longer than in older women. So in the first years after menarche, most cycles are between 21 and 45 days and last between 2 and 7 days. And this is an important slide that I'd like everyone to pay attention to, because it describes what your menstruation should look like, even as an adolescent. In a normal menstrual cycle, a female will lose about 30 to 40 mils of blood. I know that's hard for people to estimate, but that's about 3 to 6 pads per day. And a loss of more than that, more than 80 mils of blood, or bleeding that persists longer than 7 days, is an indication of abnormal menstrual flow. So if you have flooding, these are some factors which may indicate abnormal menstrual flow. Flooding, and what flooding is when you essentially have an overflow of your menses outside of your absorptive apparatus, so outside of your tampon, outside of your pad. So you're wearing a pad and underwear, but blood is running down your legs to the floor, running into the chair you're sitting in, running messing up your sheets and things like that, that's what we consider flooding. If you soak through a pad within 2 hours, that's excessive as well. So though that's how you can gauge whether you have a typical menstrual flow. Another condition that may happen in adolescent girls is primary amenorrhea. And this is a failure of menses to occur by the age of 16 once you have a normal growth and secondary sexual characteristics. So once you have breast development, pubic hair, and normal growth, if you don't menstruate by age 16, we consider that primary amenorrhea, or the absence of menses, right? If by age 13, you have not menstruated without the presence of breast development and secondary sexual characteristics, that's also abnormal, and that's abnormal absence of menses as well. That's also primary amenorrhea. And causes vary, and even in young girls who you have to exclude pregnancy. You must always exclude pregnancy because ovulation and intercourse can occur even before you have your first period. Other causes include some of the congenital abnormalities we spoke about earlier with the Müllerian abnormalities, even the unclassified ones like your imperfect hymen, which is if you're the complete wall of tissue that blocks off the vagina. You may have females who they're not menstruating, but they are, meaning that the blood is accumulating behind this wall of tissue, but they're not releasing any menstrual flow into a pad or anything. So those are some of the causes in terms of congenital abnormalities. You can have endocrine or hormonal disorders. Some systemic illnesses can cause primary amenorrhea, and eating disorders, which is important for girls in this age group who may be at risk of eating disorders. Oligomenorrhea is what is classified as menses occurring at an interval longer than 35 days apart. I mentioned in young girls in the first years after menarche can have cycles up to 45 days long, but certainly more than that, we would consider it oligomenorrhea. Any of these scenarios, though, should be promptly reported to your healthcare provider so that an assessment can be done. Abnormal uterine bleeding can also occur in this age group. And what abnormal uterine bleeding, or AUB, is, it's absence of bleeding, irregular bleeding, normally heavy bleeding, or bleeding in between the periods. The most common causes of AUB in adolescents include ovulatory dysfunction, meaning dysfunction of ovulation or releasing of the egg. And that's commonly due to immaturity of the female hormonal axis. These are the hormonal controls that govern how the ovaries, the uterus or the womb responds to the hormones from the ovaries, etc. Other hormonal disorders such as polycystic ovarian syndrome or PCOS can cause it. Coagulopathy or disorders of your blood clotting. Pregnancy, again, is another cause, and pelvic infections. I'm going to touch on PCOS a little later in the presentation, but it is a cause of AUB. What can you do to address these concerns in your adolescent child? I usually recommend that within the first year after having a first period, that the adolescent child be assessed by your healthcare provider. At this visit, a detailed menstrual history will be taken. Your child's pubertal development will be assessed, along with a detailed general history and physical examination if necessary. And at this visit, you can air any concerns that you may have about your child's menstrual flow, development, etc. Again, vigilance about reporting any concerns or abnormalities of your child's pubertal development is important. And observation of your child, effective communication with your daughter on the frequency, duration, and amount of her menstrual flow, and any symptoms of anemia she may be having. Because if you have AUB, it may lead to anemia or a low blood count. And symptoms of that are things like fatigue, tiredness, fainting, dizziness, recurrent headaches, etc. So it's important that you communicate with your daughter and find out if any of these things are happening. It's also important that you make sure your child eats a balanced diet, has regular physical activity, and maintains a normal BMI, because both obesity and being underweight, can lead to AUB. And it will be helpful if you have your daughter keep a menstrual diary. That way you have something objective to assess to see if, her menstruation is normal. You can also share it with your healthcare provider so that they can give their opinion on what her menstruation is like. Child and adolescent womb infections. Not very common in this age group, but they do happen. Most infections start in the vagina, but they can ascend to the womb if they're left untreated. And risk factors include poor hygiene and hygiene practices. Children often lack awareness about germs and where they come from and how they spread. And for us girls and women, the anus, which has quite a bit of germs there, is quite close to our genital area. And so proper wiping may easily spread bacteria. And so, it's important to educate your child on that. And, wiping back to front instead of front to back can spread germs that way. Also, thinner and therefore more susceptible to external irritants such as harsh soaps and bubble baths, etc., and tight-fitting clothes. And so that can lead to trauma and irritation, and thus a pathway for germs to infect. Sexual abuse. It's important that if infection of your child with sexually transmitted organisms especially must alert you and any caregiver to the possibility of abuse. And so this is important to assess with your child, and it goes back to being conscious and present, etc. So leads us to what can you do? Once again, as I said, conscious and present, making sure that you regularly assess your child's genitals during bathing, assess the underwear for discharge or abnormal bleeding, etc. Making sure your child is wearing 100% cotton undergarments, which, breathable fabrics, etc. Using gentle and unscented soaps down there. As I said, they're mucosa is a lot thinner and prone to irritation, so you got to leave the Bath and Body Works alone. There's lots of fragrance and parabens and all kinds of things in those types of products, so the more simpler ingredients and the gentle soaps are best. Again, vigilant reporting of any abnormalities or concerns to your healthcare provider so that prompt treatment can be instituted. Dysmenorrhea. Dysmenorrhea just means painful menstrual periods, essentially, and it can be primary dysmenorrhea or secondary dysmenorrhea. And primary dysmenorrhea is a cramping pain that comes before or during a period, and this pain is caused by natural chemicals in the body called prostaglandins, and these are made in the lining of the uterus. Prostaglandins cause the muscles and blood vessels of the uterus to contract during your menses, and so on the first day of a period, the levels of prostaglandins are quite high, and as the bleeding continues and the lining is shed, the levels usually go down. So this is why pain tends to lessen after the first few days of a period. This type of painful period usually starts soon after a girl starts having periods, and it actually tends to improve as they get older, and even childbirth tends to improve it. Secondary dysmenorrhea now is caused by an actual disorder of your reproductive organs. This type of pain tends to get worse over time, and it often lasts longer than normal menstrual cramps. This type of pain usually begins a few days after the period starts. It may get worse with the period as it continues, and it may not even go away after the period ends. And causes for secondary dysmenorrhea include things such as endometriosis, adenomyosis, and fibroids. We'll get more into that because later in the presentation, because secondary dysmenorrhea is actually more common in older women. So we will get back to this in the next age group, but it does happen sometimes in young adolescent children. So what can you do to help with dysmenorrhea, etc.? Again, making sure your child is eating a balanced diet, has regular exercise, and is taking the necessary supplements. Normal multivitamins, any multivitamin that would include vitamin B1 and magnesium, because those two in particular have some evidence on helping with period pains. Talking about your child's menstrual pains with your healthcare provider. Tests can be done to make sure it's not any structural problem that's causing secondary dysmenorrhea. Considering treatments such as NSAIDs or non-steroidal anti-inflammatory drugs. Those are painkillers such as ibuprofen, Motrin, etc. Considering those and even birth control pills to help with dysmenorrhea, because painkillers such as NSAIDs actually decrease the levels of prostaglandins, and those are the underlying compounds that lead to primary dysmenorrhea. And just being aware of that excessive pain during your menses that does not respond to painkillers such as NSAIDs is not normal. And so you have to report it to your healthcare provider. Other non-medical treatments you can try include applying heating pads or a warm water bottle to the abdomen. When I was a teenager, I remember my mother gave me a heating pad and it was clutch for sure. It really, really worked well for me. So it's something that I definitely endorse. Relaxation exercises and rest is important as well. All right. We're on to the next age group, which is reproductive age women and their womb wellness. So we're going to start off with uterine fibroids, because I know this is the one that people love to talk about. And it's important too, very important for us as Black women to speak about it. So uterine fibroids are benign, meaning not cancerous, growths that develop from the muscle tissue of the uterus. They're most common in women aged 30 to 40 years, but really they can occur at any age. They occur more often in African women or women of African descent, or in white women. They also seem to occur at a younger age and grow more quickly in us women. So, as I said, that's why it's important for us to talk about it, right? And some of the symptoms of fibroids include AUB, or abnormal uterine bleeding. Women can have very painful periods as well, lots of pain in the lower abdomen and back when it's outside of the menses. They can be dull or achy or even sharp. They can have during sex, and you can have compression symptoms. So compression of so the bladder is right in front of the womb, the bowel is right behind it. So if you have growths on your uterus, especially if they're in the front, they can press on the bladder, and that may lead to difficulty urinating or urinary frequency. If the fibroids are at the back, it can compress the bowel and lead to constipation or painful bowel movements. Your womb may look enlarged, or your abdomen may look enlarged if your fibroids are very big. They are also a risk factor for miscarriage and infertility, especially when they're on the inside lining of the womb, or submucosal, as we would call it. And then some women have no symptoms at all of their fibroids. They may do an ultrasound for another reason and just find them incidentally, as we call it, meaning they just happen upon it and see that they have fibroids and they don't have any symptoms. And some women have fibroids and don't know because, again, they don't have any symptoms. What causes fibroids? The exact cause is unknown. I get that question all the time. Dog, why do I have fibroids? What caused me to get fibroids? We don't know. The exact cause is unknown. We just know that they grow in response to stimulation by the hormone estrogen, which is the main female hormone that's produced naturally naturally in the body. But there are some risk factors for uterine fibroids. So as I said, African descent, us Black women, that is a risk factor for getting fibroids. And any situation where you have had unopposed estrogen stimulating the womb. So meaning there was at no point there's been an interruption in the stimulation of the womb by estrogen, or a longer duration of time where your uterus has been exposed to a lot of estrogen. So if you started seeing your period early, if you went into menopause late, then that would extend the time period that you've had where your uterus was being stimulated by estrogen. If you've never had children or been pregnant, because pregnancy in a sense interrupts that unopposed estrogen stimulation. And obesity, that extra fat tissue contributes to all this unopposed estrogen stimulating your uterus, right? So those are all risk factors for fibroids. So what can you do? Again, eat a balanced diet and exercise. Maintain a healthy body mass, which is just your height to weight ratio. And so women should avoid significant weight gain after age 18, maintain a normal body weight. Body weight tends to increase estrogen production, and that may aggravate fibroid growth. Avoidance of diets high in sugar, because again, that tends to aggravate fibroid growth in some studies. You need to have a diet that's high in fresh fruits and cruciferous vegetables. Those vegetables are things like cabbage, arugula, cauliflower, broccoli, collard greens, things like that. And avoiding soy-based foods. There are studies that show that soy-based foods can aggravate fibroid growth because they contain phytoestrogens, which are naturally occurring compounds that can mimic natural estrogen. So avoiding soy-based foods may have an effect on reducing fibroid growth. And of course, promptly presenting to your healthcare provider if you think you have symptoms of fibroids. Endometriosis and adenomyosis. These are conditions that affect this age group as well, and the womb health of this age group. Endometriosis is a condition in which the type of tissue that forms the lining of the uterus, the endometrium, that type of tissue is found outside of the uterus. So it can be found on the lining of the pelvic walls, it can be found on the tubes, on the ovaries, on the cervix, even on the bladder and the rectum, and even in the vagina. Adenomyosis is a condition where that tissue is found in the muscular wall of the womb. So in this layer here, that's what's called adenomyosis. And adenomyosis is actually what Gabrielle Union has, which is why she, I don't know if you guys pay attention to celebrities, but she's had lots and lots of miscarriages due to that condition. So what are the symptoms of endometriosis and adenomyosis? Endometriotic tissue responds to changes in estrogen, just like the lining of the womb, right? So when you have the fluctuations in estrogen throughout your menstrual cycle, the tissue, wherever it is, as I said, it's not where it ought to be, which is on the inside lining of the womb. It's found on the tubes, in the pelvis, on the surface of the womb, on the surface of the ovaries, etc. When those hormones fluctuate throughout your cycle, the tissue behaves the same way. So it may grow and bleed like the uterine lining does during the menstrual cycle. So when that happens, you have surrounding tissue that can become irritated, inflamed, and swollen. And then all this breakdown and bleeding of this tissue each month leads to scar tissue formation and adhesions. And that causes organs in your pelvis to stick together. And so you end up with lots of pain and chronic pelvic pain. That's one of the main features of these disorders, especially before and during your period. You can also end up with painful sexual intercourse, painful bowel movements, because as I said, it can be this endometriotic tissue can be deposited on the bowel and bladder, painful urination. Normal uterine bleeding is also a feature, as well as infertility and recurrent miscarriage. And some patients also have endometriosis and actually have no symptoms at all. The cause of these conditions is unclear. It does have a familial component, meaning that if your mom or your sister has it, you're more at risk of getting it. There is a theory, there's several theories on how endometriosis happens, but one of the main ones is retrograde menstruation, meaning that menstrual blood gets backed up into the female genital tract, so it gets pushed back through the tubes and into the pelvis, and into the peritoneal cavity, and that is what leads to endometriosis. But that's just one theory. There are several which are beyond the scope of this present. That is one of them. So what can you do to try and stave off some of the problems that occur with these conditions? Again, eating a balanced diet and exercise. Presenting early to your healthcare provider if you think you have symptoms of endometriosis, because it's been found that early treatment can arrest the progression of endometriosis and adenomyosis, especially when you catch it early. Oral contraceptive pill use, OCPs, or oral contraceptive pills have been found to offer some degree of protection against these conditions and the complications of these conditions by lowering estrogen exposure. Breastfeeding is also somewhat protective against endometriosis. Studies have found that for every additional 3 months of total breastfeeding per pregnancy, your risk of endometriosis lowers by about 8%. Avoiding or limiting alcohol consumption. Alcohol raises estrogen levels, which could lead to even more painful symptoms. And of course, again, exercise will help with pain symptoms and may decrease the stimulation of the endometriotic tissue. Endometrial and cervical polyps. Polyps are overgrowths of cells in the lining of the womb, leading to benign outpouchings of that lining. So the outpouchings can be of the lining of the cervix, as you see in this picture. That's a cervical polyp, that little red area right here. Or they can be on the inside lining of the womb, where there's outpouchings of the lining of the womb. Symptoms of endometrial and cervical polyps include AUB, or abnormal uterine bleeding, and even postcoital bleeding. As you can probably tell from this picture, this red tissue is pretty friable, meaning it's very sensitive and soft and easily traumatized. So during sex, you don't really, once there is any friction or anything, it may start to bleed after sex. Risk factors for endometrial and cervical polyps include obesity, hypertension, and certain medications such as tamoxifen. Tamoxifen is a medication that's used to treat breast cancer. So what can you do? You can eat a balanced diet and exercise and maintain a healthy BMI, because as I said, obesity is a risk factor for polyps. Lifestyle modifications and treatment for your hypertension, which again is a risk factor for polyps. And prompt presentation to your healthcare provider if you have symptoms of polyps. Polycystic ovarian syndrome. This is a disorder of the hormonal axis of the reproductive system, and it leads to anovulation or failure to ovulate, menstrual dysfunction, and signs of abnormal androgen levels. Levels are male type hormones, which are abnormally high in PCOS. Now, PCOS isn't technically a womb disorder. It's really a hormonal disorder, but it definitely does affect the womb, and it affects the womb by leading to abnormal uterine bleeding and infertility. Symptoms and signs of hirsutism include signs of PCOS, include hirsutism, which is male pattern hair formation. So hair on the chin, on the upper lip, on the jawline, on the chest, and a pattern on the abdomen. Also infertility, because as part of this disorder is where you don't release an egg every month. So difficulty conceiving is definitely part of the constellation symptoms and signs. And diabetes. Now, PCOS has a strong insulin resistance component to it. And so it's one of the factors that can of developing diabetes. And for that reason as well, weight and obesity has a lot to do with being at risk and having PCOS. PCOS is a disorder that increases one's risk of womb cancer, diabetes, and metabolic syndrome. So what can you do to help prevent or deal with PCOS and reduce the complications? Weight loss. Weight loss is one of the first line things we recommend in PCOS management for many reasons. For one of the reasons is because being obese puts you at risk of having PCOS. And that's not to say skinny people or people with a normal BMI don't get PCOS, they certainly do. However, weight loss in obese women with PCOS has been shown to significantly restore their ovulatory cycles and eliminate some of the complications such as difficulty conceiving, etc. in PCOS, right? Weight loss in obese women with PCOS also improves the hyperandrogenetic features. So it helps with the hair growth, the acne, the abnormal hair formation, etc. Limiting carbohydrates in your diet, because as I said, PCOS is a risk factor for diabetes. So you want to eliminate even more risk factors by controlling your diet. And also high carbohydrate diets might increase insulin, worsen the insulin resistance of the PCOS. So it's important that you change your diet, exercise, lose weight if you are overweight, so that you have a healthy BMI, which should be less than 30. And of course, if you think you have PCOS symptoms, that you promptly present to your healthcare provider so that you can be assessed and managed appropriately. So we're back again to abnormal uterine bleeding, which, as I said before, is the absence of bleeding, irregular bleeding, abnormally heavy bleeding, and bleeding in between periods. Once ago, each of these different types of abnormalities with menstrual bleeding had their kind of own classification, but they've all since in recent years been grouped under one heading, which is abnormal uterine bleeding. So that's why you hear me describing it in that way. It's sort of a blanket term now to essentially encompass all irregularities of menstrual flow. So in this age group, reproductive age women, the most common causes of AUB include uterine fibroids, endometriosis, adenomyosis, endometrial or cervical polyps, and ovulatory disorders such as PCOS. So I'm going to put this important slide up once more to remind us what a normal menstrual flow looks like. 3 to 6 pads or tampons each day, not more than 80 mils of blood, or periods that don't last longer than 7 days. You should not have significant flooding where it's running down your legs to the floor, even though you're wearing your pad. You shouldn't be sitting in your clothes and your underwear and your pad and your chair is full of blood. And you wake up and your sheets are soaked, that kind of thing. And you definitely should not have to change a fully soaked pad within 2 hours. So what can you do? You should be having your regular yearly well woman visits with your healthcare provider. You have to be vigilant about reporting any concern you have about possible AUB, eating your balanced diet and exercising, weight loss, which we spent a lot of time speaking about just now with regards to PCOS. But as you've noticed, obesity is definitely a risk factor for several things that can affect your womb health. And you may benefit as well from keeping a menstrual diary that you can look back on and gauge what your menstrual flow is like and whether you think it has changed over time. And it can be shared with your healthcare provider to help you collectively determine whether there is any AUB and what the next step needs to be. Dysmenorrhea. So we're back to dysmenorrhea in this age group. And again, this is painful menstrual periods. Secondary dysmenorrhea, or dysmenorrhea that's secondary to a structural cause or disorder in the reproductive organs. This type is more common in this age group, and causes in this age group include uterine fibroids, endometriosis, and adenomyosis. What can you do? Again, eating a balanced diet, and regular exercise. Excessive pain, again, during your menses that does not respond to painkillers such as NSAIDs is not normal, and you have to report it to your healthcare provider. You can again try the same non-medical treatments as adolescence: heating pads, warm water bottle to the abdomen, relaxation exercises, and rest. The reason why, I mean, it's important for both age groups to present to your healthcare provider, but because secondary dysmenorrhea is more common in this age group, which suggests that there is an actual disorder or structural problem with your organs, it's even more imperative for this age group to report dysmenorrhea, because you may need further testing and imaging and other things to determine if there is actually a problem with your organs, why you're having such painful menses. Pelvic inflammatory disease is another condition that can affect womb health and womb wellness in this age group. Pelvic inflammatory disease is an infection of one or more of the upper reproductive organs, and that includes the uterus, fallopian tubes, and ovaries. It most often occurs when sexually transmitted bacteria spread from your vagina to your uterus and then your fallopian tubes or ovaries. The most common culprits are gonorrhea or chlamydia, and these bacteria are usually acquired during unprotected sex. And so your risk factors include having multiple sexual partners, being in a sexual relationship with a person who has more than one sexual partner, having sex without a condom, having a history of PID in the past, or having a STD in the past. Symptoms of PID include pain in your lower abdomen and abnormal vaginal discharge. I just want to pause right here to kind of describe what a normal vaginal discharge looks like, because that may not be common knowledge. The vagina normally has what we call a physiological discharge, and that's just a discharge that is normal in the vagina because of the hormonal changes of your menstrual cycle, because of the normal bacterial flora that's in the vagina. All those things contribute to a normal physiological discharge of the vagina. And that physiological discharge is usually white. It is not usually copious or a whole heap. It's not like, you know, it shouldn't be soaking down your underwear to the point where you need to wear a pad. It does not have an odor. It, as I said, is white. It's usually of a thin but not thick, a not thin but not thick consistency. I'm not sure if that makes sense, but the consistency is pretty neutral, put it that way. And it should not cause any symptoms. So you shouldn't have no itching and no burning and no nothing like that. That is what a physiological discharge is. So PID, you'd have an abnormal discharge. So it would look yellow, it may have an odor, it may be thicker than usual, thinner than usual, that kind of thing. You may also have chills or fever with PID, and you can have nausea and vomiting. If left untreated, PID can severely affect womb health. And so what happens is, as you see in this picture, you end up with a lot of inflammation and scar tissue formation around the womb that can cause the tubes to be stuck to things, the womb to be stuck to things. And so those put you at risk of getting an ectopic pregnancy, which is a pregnancy occurring outside of the womb, usually in the tubes, because the tubes are unable to move in the normal fashion to allow passage of a fertilized egg down to the womb where it should go. So it ends up getting stuck in the tube and you end up with an ectopic pregnancy. I saw a raised hand, but now it's gone. Okay. Feel free to hold off till the end. We're getting there. PID can also lead to infertility because, again, your tubes may become blocked by all these scars and adhesions. And these scars and adhesions can lead to chronic pelvic pain as well. And if the infection is severe enough, it can lead to abscess formation, tubo-ovarian abscesses, which are collections of pus in the pelvis. So what can you do to reduce your risk of getting PID? practice safe sex and use barrier or condoms. Limit your number of sexual partners. Get tested for STDs if you feel like you live a high-risk lifestyle, and have your partner tested for STDs if you feel like he or she has a high-risk lifestyle. Be monogamous. So after you're tested and cleared and your partner is tested and cleared, you guys just only have sex with each other, and you should significantly reduce your risk of getting PID and its complications. Do not abuse alcohol or drugs, because substance abuse tends to increase risk-taking behavior and may put you at risk of STD exposure. And of course, if you think you have symptoms of PID, present in a timely fashion to your health care provider. Unwanted pregnancy. I thought it was important to include this as a part of womb wellness, because it's something I see quite often and something that can actually be very easily avoided. And it does have significant complications for womb wellness. And these complications include trying to get and procure unsafe abortions, which can lead to significant womb complications. It also causes women to delay their antenatal care. So you have an unwanted pregnancy, so you kind of put it out of your mind, you don't really pay attention to it, and so you don't really go to the doctor with regards to antenatal care or care during pregnancy. And that can not only affect your womb wellness, but if you happen to have a girl inside the tummy, then that can affect her womb wellness, as we spoke about in the beginning part of the presentation. It also presents unwanted physical demands on your body and your womb. You may have just had a baby, you may have just had surgery, you may have had different things where your womb wasn't quite ready for this pregnancy. And so that presents a challenge physiologically. Apart from that, and this will have an effect on your overall well-being, you now have unintended demands on your economic assets, which can lead to failure to achieve academic and or career goals. It can lead to familial or social discord in your relationships, in your family, etc. And of course, mental anguish. So what can you do? Talk to your healthcare provider about family planning. Talking to your healthcare provider, they can inform you about all the available birth control options. They can take your history and examine you if necessary to see which option is best for you and decide as a unit which one you will use. You can access the available free birth control methods on island. Again, St. Kitts is very lucky where birth control is available for free of cost in almost all the healthcare centers. And so unwanted pregnancy can actually be very easily avoided, because as I said, it's not like you have to pay for birth control. And as I said, healthcare providers are available in the free health centers to discuss with you which ones are best for you. And women, you definitely have the power to exercise your own autonomy over your reproductive health and consequences. It's very clear that the consequences of reproduction and sexuality for women or between men and women usually have to be borne by the woman. You know, we are the ones who really have to deal with the end result, especially when the end result is pregnancy. And so because of that, you definitely have the right to exercise your own autonomy over your reproductive choices and consequences. And there are birth control methods out there that your partner doesn't even have to know about or know that you're using or realize that you're using. Obviously, if you choose to include them in that decision, that's, again, your choice, but you definitely have to. Infertility is important to talk about because it does have to do with womb wellness, and infertility is a failure to conceive, the failure of a couple to conceive regardless of the cause, after 1 year of regular unprotected intercourse. And different things can lead to infertility. You have male factor infertility, you have tubal factor infertility, and then you do have uterine or womb factor infertility. And the things that can lead to womb factor infertility include the congenital abnormalities we spoke about in the beginning, the abnormalities of the womb that a baby can be born with. A condition called Asherman syndrome, which is where scar tissue or adhesions are formed on the inside cavity of the womb. And that can be secondary to infections like PID, or that can also be secondary to prior surgery such as DNCs. Those can lead to these scar tissues and adhesions forming on the inside cavity of the womb, which can make it difficult for sperm to pass through, for eggs to implant, etc., and lead to infertility or difficulty conceiving. Uterine fibroids can also put you at risk of difficulty conceiving, especially when they are on the inside lining of the womb or underneath the inside lining of the womb. That would be submucosal fibroids. And of course, with age, your risk of infertility increases. So what can you do? Timely presentation to your healthcare provider with your partner for evaluation after a full year of regular unprotected sex with no conception. Remember that conception is a couple's assessment because you're not trying to conceive by yourself, right? So you and your partner would need to be assessed to determine the cause of the infertility, if one can be found, and what the next step needs to be. Eating a balanced diet and exercise, and maintaining a healthy BMI, utmost importance. Women who are underweight, overweight, or even women who exercise too much may have a harder time getting pregnant. In women, you also have to limit your alcohol consumption. Drinking alcohol at a moderate or heavy level can reduce fertility. Smoking also can reduce fertility. In men as well, smoking and heavy drinking and using marijuana can affect your sperm count and movement. That's just an aside. That don't really have anything to do with womb health wellness, but as an aside. Practicing safe sex. As I said, PID is a risk factor for infertility and fertility conception problems. So decreasing your risk of getting important, and of course, reducing your stress level. Brings us to the final age group we're going to look at, and this is the perimenopausal and menopausal woman and their womb wellness. So let's talk about what perimenopause and menopause is. Menopause is a time in a woman's life when she naturally stops having a menstrual period. The average age of menopause is 51 years, and menopause happens when the ovaries stop making estrogen, and that marks the end of that woman's reproductive years, right? Beginning in about your 30s and 40s, late 30s, early 40s, the amount of estrogen you produce begins to fluctuate. And those years leading up to the menopause are called the perimenopausal years. During this time, your menstrual cycle will likely change. Cycles may become longer than usual, or they may become shorter. You may begin to skip your periods. The amount of your flow may become lighter or even heavier, right? Although changes in menstrual bleeding are normal during the perimenopause and menopausal period, you still should report them to your healthcare provider because they may also be a sign that something is wrong. Signs and symptoms of menopause. As we were just talking about, you can have abnormal uterine bleeding. Everybody knows about the hot flashes, which is a sudden feeling of heat that rushes to your upper body and your face, and that can be accompanied by night sweats. You have sleep disturbances where you have insomnia, trouble falling asleep. You may wake up earlier than usual. You may have these night sweats, which can disrupt your sleep as well. You may have mood changes, decreased sex drive, memory loss. You may have vaginal and urinary tract changes because vaginal dryness may start. The lining of the vagina becomes thinner and less elastic in this age group and around the time where your estrogen is starting to decline. And so that can lead to more frequent vaginal infections, more frequent urinary tract infections, and pain during sex. So what can you do to help with some of these womb issues? Well, again, eating a balanced diet that will help you to stay healthy before, during, and after menopause. Exercising is very important in this age group because with menopause, that does affect your bone mineral density and your bone strength. And so a balanced diet is important, which includes vitamin D and enough calcium so you maintain your strong bones. Regular weight-bearing exercises will slow down your bone loss and improve your overall health and keep your bones strong. Making sure that you keep up with your regular well woman visits during this period, right? In terms of the vaginal symptoms, moisturizers, lubricants can also help. Therapy for some of the mood changes may be beneficial. Pelvic floor exercises are important because the pelvic floor muscles become more not as strong and not as sturdy in this age group because of the decline in estrogen and other factors which we'll get into in a little bit. So performing pelvic floor exercises, we'll get back to this in a minute. Quitting smoking. Smoking actually has been found to increase hot flashes, and smoker quitting is important. Limiting alcohol consumption because that also may worsen your sleep disturbances. Staying socially and mentally active to stave off the memory issues. So crossword puzzles, reading a lot, staying socially active. Some herbal supplements have some evidence that they help with some of the menopausal symptoms, and these include using primrose oil, red clover, black cohosh, and soy. Because we mentioned earlier that soy contains naturally occurring phytoestrogens, which mimic our natural estrogen, which we're going to lose at menopause. So, postmenopausal bleeding. Now, this is bleeding that occurs a year or more after your last period. The causes of postmenopausal bleeding are usually inflammation or thinning of the vaginal lining or the womb lining. So atrophic vaginosis is what happens when you have thinning or inflammation of the vaginal lining, and endometrial atrophy is thinning or inflammation of the womb lining. Cervical or womb polyps can also cause postmenopausal bleeding, and a thickened womb lining can also cause postmenopausal bleeding. And things that lead to a thickened womb lining include hormone replacement therapy, being overweight, and other causes of high levels of estrogen. And these are all conditions which can put you at risk of getting womb cancer. Which leads us to the last cause, which is in less frequent cases, postmenopausal bleeding is caused by cancer, such as womb cancer or even ovarian cancer. So what can you do? Promptly report postmenopausal bleeding to your healthcare provider. Even if it only happened once, even if it's only a small amount or just spotting or it look pale or it look pink or it look brown, report it. Even if you don't have any other symptoms, even if you're not even really sure if it's blood, still report it so it can be assessed. Eat a balanced diet, exercise, maintain a healthy BMI. Being overweight can put you at risk of a thickened womb lining, which can lead to cancer. Maintain your regular yearly well woman visits with your healthcare provider where any abnormalities can be assessed. Most of the time with postmenopausal bleeding, it's not usually serious, but it can be a sign of cancer, and so cancer must be ruled out. Cancer is best treated when it's found early. Cancers of the womb. Most cancers of the womb start in the lining of the womb, and that is endometrial cancer. They can also occur in the muscle layer of the womb, and those are uterine sarcomas. And they can happen to the neck of the womb or the cervix, and that's cervical cancer, which is a sexually transmitted cancer, everyone. So it's not something you inherit from your family or nothing like that. It's caused by sex. So it's Cervical cancer is caused by a virus called the human papillomavirus, which is usually transmitted as a sexually transmitted infection. And this virus infects the cells of the cervix and causes them to become abnormal. And it's these abnormalities that we look for on a pap smear, which is why it's important to do your yearly pap smear. So we're going to get back to that in a minute. What are the risk factors for each type of cancer? For endometrial cancer, which is cancer of the lining of the womb, older age is a risk factor. Any condition where you've had continuous stimulation of the lining of the womb by estrogen. So if you had more years of menstruation because your first period came early or your menopause came late, if you've never had a pregnancy, also obesity is a risk factor for endometrial cancer because the extra fat tissue contributes to all this hormonal stimulation of the lining of your womb, which can lead to cancer. PCOS, as we mentioned, is a risk factor for endometrial cancer, and endometrial cancer also has a familial component where if you have a first-degree relative with it, more at risk of having it yourself, getting it yourself. Cervical cancer is different. As I said, this is cancer of the neck of the womb, and this is a sexually transmitted cancer. So risk factors include starting to have sex at a younger age, having multiple sexual partners, having promiscuous male partners, a history of having STDs in the past, and HIV. Symptoms of cancer of the womb include postmenopausal bleeding, as we said, abnormal uterine bleeding. You may notice that you have a pelvic mass that has doubled in size in a month, so rapidly enlarging pelvic mass. And if you have rapid unintentional weight loss, those can be signs of cancers of the womb. So what can you do to help prevent that? Eating a balanced diet and exercise, maintaining a healthy BMI. Can't stress that enough. I hope that everyone realizes that for everything about what you can do to ensure your wellness, your womb wellness, those two things are there in every slide because they basically affect almost every part of your well-being, including your womb wellness. But yes, so obesity, as we said, is a risk factor for endometrial cancer. So maintaining a healthy BMI is important. Regularly going to your yearly well woman visits with your healthcare provider, and regularly doing your pap smears, which is a screening test for cervical cancer. We are very lucky when it comes to cervical cancer that there is an effective screening tool in a pap smear. And so you can catch abnormalities early and treat them before they have time to even get to cancer. So doing them yearly is important. And so we can't stress that enough. Screening is where the focus definitely needs to be. And pap smears are available free of cost throughout the island in all the public health care centers. And so esthetician and division women have no excuse for why they have never done a pap smear. And whilst we're on that topic, some women don't actually know when they should start doing pap smears. The guidelines suggest that once you reach age 21, or you have been having sex for up to 3 years or more than 3 years, that's when you start doing your pap smears. So again, they're free of costs throughout the island. Limiting your number of sexual partners and practicing safe sex, that definitely reduces your exposure to HPV and thus reduces your risk of cervical cancer. And of course, if you think that you have symptoms of either endometrial or cervical cancer, you need to promptly report it to your healthcare provider. Uterine prolapse. This is another womb disorder that can happen in the menopausal or perimenopausal woman, and that is when the pelvic floor muscles and ligaments are weak and stretched, and they can no longer provide enough support for the uterus to keep it in place. And as a result, the uterus slips down into or protrudes out of the vagina. And you see a picture there where you see that bulge coming down. That's what happens because the pelvic floor muscles are now weak and can't provide that support anymore. So this picture shows this kind of sheet of pelvic floor muscles where your rectum passes through it, your urethra, which is the tube you pee from, your vagina passes through these holes, right? So your organs are kept in place by these pelvic floor muscles. So when they become weak for any reason, then you can end up with uterine prolapse. So risk factors that lead to these weakened muscles include a history of difficult or traumatic childbirth. So if you've had lots of episiotomies and perineal tears into these muscles, etc., the muscles can become weak. If you've delivered very large babies, can weaken the muscles. Menopause in and of itself, because estrogen helps to keep these muscles supple and strong. Obesity, because if you have a lot of weight bearing onto these muscles, then that contributes to their weakness over time. Chronic constipation. So if you're repeatedly straining during bowel movements, that can again cause lots of pressure to be transmitted to these pelvic floor muscles and weaken them over time. Same thing with repeated heavy lifting, same thing with chronic coughing or bronchitis. You're constantly applying pressure to those pelvic floor muscles. And increasing age as well. Essentially, our muscles get weaker with age in most cases. What symptoms do you have of uterine prolapse? Women describe a sensation of heaviness or pulling, a dragging sensation in their pelvis. You may actually see the tissue protruding from the vagina in the picture we showed earlier. You may have urinary problems because, as I said, one of the things that can also prolapse is parts of the bladder and urethra. And so you may have urinary leakage or incontinence or difficulty holding your urine, or you may have urinary retention or feel like you have incomplete emptying of your bladder. You may have difficult bowel movements because parts of the rectum may also prolapse down to the vagina. You may feel as if you're sitting on a ball, or there's some bulge in the vagina, or something is falling out of your vagina. Most of the times these symptoms are less bothersome in the morning, and as the day progresses they get worse because once you're up and about, etc., gravity can make the symptoms worse. What can you do to help stave off prolapse? Eating a balanced diet and exercise, maintaining a healthy BMI. Obesity is a risk factor for prolapse, so healthy BMI is important. Regular yearly well woman visits with your healthcare provider so that any abnormalities can be addressed. Performing pelvic floor exercises or Kegels exercises. So this is important again. And these are things you can do every day, and you ought to do every day, especially when you're getting to your perimenopausal or menopausal years. And what that is basically holding in your pelvic floor muscles as if you're holding in your urine, holding in your stool. You hold it for about 10 seconds, and then you relax it for 10 seconds. And then you do that 8 times, 3 times a day. And you can do it when you're at your desk at work, when you're watching a movie, when you're, sitting on a plane. Very easy thing to do. Treat and prevent constipation. So lots of fluids, high fiber diet so that you don't end up straining with every bowel movement. Avoiding heavy lifting and lifting correctly. So when you're lift with your legs and not your waist or back, so you have less valsalva or straining. If you have a chronic cough, you get it treated, and you don't smoke, because of course smoke will aggravate a chronic cough. And those are some of the things you can do to help with prevention of prolapse. And that brings us to the end of the presentation. And I hope that it's been clear throughout the presentation that womb wellness really starts with you. There are many, many things that we can do to ensure our womb wellness in conjunction with our healthcare provider. Questions?
Wonderful, wonderful. Thank you so much, Dr. Manchester, for that very comprehensive, very insightful presentation. So thank you so much. So does anybody have any questions for Dr. Manchester? I see that somebody has their hand up. Is Lucia? Lucia, do you want to ask a question? Let's see if you can put it in the chat or you can ask it. Or maybe it was a mistake.
I think I saw someone with their hand up, but then it went away, so.
Okay. So does anybody have any questions for Dr. Manchester? It's not seeming like we have any questions. No questions for Dr. Manchester? While you have a here, very experienced obstetrician and gynecologist. Okay, we have somebody with their hand up. You can unmute yourself. I think Keriise Wallace has a question.
Hi, Dr. Manchester. How do you tell the difference between vaginal prolapse and uterine prolapse?
So your healthcare provider usually will perform a speculum examination, usually with a specific type of speculum, the SIM speculum, which is a half blade, to retract both the, so we retract different segments of the genital organs that can prolapse to see what exactly is prolapsing. So we would retract the posterior vaginal wall and the cervix and ask the patient to cough or strain and see if the anterior wall prolapses. Then we would retract the anterior wall and the posterior wall of the vagina and not retract the cervix to see where, and ask the patient to strain or cough and to see if the cervix comes down. If the cervix comes down, that is uterine prolapse. Then we will retract the anterior vaginal wall, the cervix, and ask the patient to cough if the posterior wall, and see if the posterior wall of the vagina prolapses. So that's how we tell. And different parts would have different symptoms, right? So as I was saying, parts of the bladder and urethra, which is a tube where you urinate from, can also prolapse, and those will usually involve the anterior vaginal wall, less so the cervix and the uterus. Same thing with bowel movement symptoms. If you have those, then it's more than likely the posterior vaginal wall that's prolapsing, as opposed to, again, the actual uterus. I hope that answers your question.
Great. All right, so we have a question. So thank you for answering that question. And so that next question is, how might long-term consistent use of birth control impact womb health and womb wellness?
Well, I did allude to it a few times throughout the presentation. So it helps with symptoms of PCOS and the menstrual irregularities of PCOS. It also improves endometriosis symptoms and dysmenorrhea symptoms. It also reduces your risk of endometriosis. It also prevented pregnancy. And in terms of your abnormal uterine bleeding in general, it also significantly reduces that.
Okay, great. So I hope that answered your question. So another question is, let me see. Can birth control affect fertility after long-term use?
That's highly dependent on a specific birth control method that's used. So for example, the injectable contraceptive can affect fertility for up to a year after discontinuing it. So the return to fertility after the injectable contraception specifically can take a lot longer than other methods, up to a year sometimes. None of the methods, unless you're doing something like a tubal ligation, is permanently going to affect your fertility. But as I said, some methods decrease the return or increase the time to return of fertility after you stop it. So something like Depo-Provera would take a longer time for you to get back to your fertile normal cycle and start ovulating after you stop it. But generally speaking, I guess the short answer is no, because as I said, the only one that would permanently affect whether you conceive or not is tubal ligation. The other methods, as I said, are, whilst they may be long acting, they are reversible. And certainly the short acting ones like oral contraceptive pills don't usually have any long-term effect on your fertility, even if you've been using them for a long time. And then there's another question here. Does multiparity increase the risk of uterine prolapse? Absolutely. Absolutely. The more babies you deliver, the more risk you have of pelvic floor trauma and damage. So definitely.
Great. So any more questions? Any more questions? No more questions. Okay, so it doesn't look like we have any more questions. So for the moment, I would just really like to say a big thank you to you, Dr. Manchester, for taking the time out of your day and for preparing such a comprehensive and insightful presentation. So we really do appreciate your time. It was really informative, and I'm sure everybody has left here or will leave here today feeling empowered and informed about their womb health. So thank you so much. Also, thank you to everybody for attending today. Definitely appreciate you coming out on a Sunday for the presentation. So I just hope that you all found it to be useful. So we've recorded the session today. So the recording will be available soon so that you can refer back to it in case you have any questions or would just like to listen to the presentation again. But I suppose in the meantime, as you can see, Dr. Manchester has her contact details for her clinic on the screen. So I guess you could take a screenshot, and if you wanted to speak to Dr. Manchester afterwards, then you can do that. And I guess with all that being said, everybody, that's it. Have a great rest of the day. And obviously, if you have any questions after the event, you can email info@lakehealthandwellbeing.com, and we'll pass the questions on to Dr. Manchester if you obviously don't contact her directly yourself. So thank you everyone for joining, and enjoy the rest of the day.
Thank you.